Associate Professor Honey Heussler from Queensland Children's Health, who's going to talk to us about the National PWS Centre of Expertise, a platform to accelerate research and translation, but also humans in the loop that can help build that common vocabulary and help navigate the system. Come up. Thank you.
I think all the previous speakers have really negated the need for several of my slides, which were the why slides at the beginning. So what I want to do is talk a little bit about how we've come to this point and what are the next steps and how we think this can actually be used in a great way to actually accelerate some of the research and data and where our first thoughts are at this point in time. So I'm going to talk about the Centre of Expertise. I'd just like to pay my respects to the Gadigal people of the Eora Nation here in Sydney. I work on the land of the Yugara people in Brisbane, and I grew up on the lands of the Inangai people in far western Queensland. So because of where I grew up, I'm absolutely passionate about access. So rural, regional, and people who don't have access. And I think that's why I've been passionate about supporting rare disorders and developmental disability over the years. I am the director of a clinical trial centre for rare neurodevelopmental disorders in Brisbane and am a developmental paediatrician and a sleep paediatrician. So in fact, you can see how I've ended up in the Prader-Willi space over many, many years. I run a number of clinical trials across multiple rare disorders and starting to get into the Prader-Willi space. So the Queensland story is really that we've had a Prader-Willi, a multidisciplinary clinic there for many, many years, even in the previous hospital we were in before we integrated. We know that families, as clinicians, we know that families feel lost when they have complex disorders and when they get that initial diagnosis across lots of rare neurodevelopmental disorders, and that much of the challenges that people find, and clinicians as well, is in that navigation. You know, the amount of time that clinicians spend in doing and supporting families to get to the right places is huge. And since the NDIS, guys, I can tell you our clinicians spend 60% of their time writing letters to support that connection and navigation. That's a huge amount of stuff that is not recognised in the acute healthcare system, but I digress. So I think one of the key things for this was that none of us actually read a book that tells us everything about Prader-Willi or any other rare disorder, and there are thousands of rare disorders. So when we're thinking about how do you build expertise, for most of us in my era, it's reading some literature and seeing lots of families and learning from them. So in fact, that partnership between families and clinicians is absolutely paramount in both research and clinical care. So lots of rare care models, and I suspect there's going to be different models of care for those that are more common rare disorders like Prader-Willi syndrome versus the ultra-rare where there might be one or two in Australia. And there are different models around Australia for that. But when we think about these things, you know, as clinicians and I think as families, having that support and key coordination is key. And so when Kathleen came to me and said, we want to try and make this better, okay, she was speaking to the converted, really. And so that's where we started talking a little bit more about what we could do. There is some evidence about a nurse navigation system in the US, really demonstrating from Jessica Jewis's work in Colorado, demonstrating that the idea of nurse navigation, having that nurse connection, was able to reduce hospital stays, presentations to the emergency departments, let alone that qualitative stuff of a patient's experience in the system. So really a no-brainer that actually when we're thinking about this, we might start with a couple of nurse navigators because we have to start small, you know, we don't have squillions and squillions of dollars yet, but starting with a couple of nurse navigators. And with thanks to the Prader-Willi Research Foundation, we've now got 2 nurses funded for a small amount of time in Queensland and New South Wales. So the other things we wanted to do was to build that centre of expertise because, as we know, even the experts learn by seeing patients and learn by connecting with colleagues who are experts. So we wanted to form a networked group. Now, Australia being, you know, the same size as the US and a fairly big country, you know, meeting in the lunchroom is not going to work. We needed to set up a virtual sort of centre. And so that's why the word virtual's in there. We need to network it because there are multiple disciplines involved in caring for your children and adults. It's cross-disciplinary. And that leads into some of the research story. You know, the more I've delved into this, every clinic person that sees children or adults with Prader-Willi, they all have little clinical databases and they all have, you know, bits and pieces of data around. But in terms of trying to form a platform for research, we're not going to learn by, you know, this person having 10 patients and this person having 15. We actually need to try and pull it together. And we need it across the lifespan because, you know, no offence to adult colleagues, but a lot of these issues start in childhood. And so we need to know the impact moving right through. So and we've got a couple of sort of key projects we're working through. We needed to make sure it aligned with numbers of priorities across Rare Voices Australia, the National Action Plan for Rare Diseases and the UN resolution for rare diseases as well, and put it in the Australian context, okay? That's really important. There are lots of different models of care that we need to think about in the Australian health system. One is our entire health system is based on acute hospital models, not long-term chronic care, and it's not funded for that. And the more I grow and get more senior in the organisation, that sort of funding for care is really important. And how do we shift that across all developmental services? Thinking about creating a model of change. So when we innovate and make new models of care, such as we're doing with nurse navigation, we need to evaluate it. And we really need to think about how we look at the impact of that, A, on the health system. You know, cost is what speaks to politicians, so we need to health economically evaluate it. We need to look at the impact on you guys and families. So really, one of the things that we're really prioritising at the moment is looking at health system modelling and how these innovative models of care can actually impact both the health system and life experience within the health system when you have a disorder such as Prader-Willi syndrome. And dare I say it, this has potential to model for many other disorders as well, okay? We need to really focus on starting early, setting up good relationships and good systems early. And the work that the Prader-Willi Research Foundation did with patients and families has really identified that you guys had put down as a priority that starting well is how we put it in developmental terms. So as soon as you get a diagnosis, you get the right information, you connect it to the right people, and you have a partner in your journey moving forward. So that was kind of one of our focus. It needs to be integrated research and clinical care. And so, you know, trying to pull those things together is really important. And lifespan is where we want to go. So we've building the network over the last 12 months since we started thinking about this. We've got our steering committees together. We've got a clinical advisory committee. And dare I say it, the number of clinicians every time we meet grows. So there is incredible interest in growing this network across Australia. We've got, at the moment, significant clinician input from Sydney and Brisbane. We've got Melbourne coming on board now, a number of people from Victoria. There's interest from WA. We're really starting to grow this well. just yesterday we had a afternoon meeting where we were trying to set some priorities about how this platform would inform the research, but also building the expertise. So we're starting to look at monthly meetings in a sort of networked sort of way for we can present complex cases so we can learn as well. We're looking at building standards of care across Australia, trying to get away from this state by state, different clinic doing different things. You know, it's not different, it's kind of, you know, variations on a theme, if you like, but trying to build that a little bit. Looking at the care models. And so yesterday was really about priority setting and how do we start to integrate that research into everything we do. So there were two main focuses really on where we think we're sort of headed at the moment in terms of research. One is looking at the model and focusing really on the impact of good nurse navigation in that space. So that's number one, and that impact on early diagnosis, okay, and seeing how that can change the sort of quality of care for families and the impact on the health system. Then the other one is supporting this digital assistant work in terms of getting access to information and that free flow, because we're not going to be able to train every GP to know everything about Prader-Willi. That's just not going to happen. We need to think about how do we move up and down the system so that everybody has access to that expertise. Okay, so that's where the AI work comes in. Looking at different models, consultation liaison models, and evaluating each of those as we go. And then looking at those comprehensive, individualised, integrated care plans, how does that impact as well? So I've got a number of little thoughts in that space. Then the other big thing is how do we get data to work for us? Okay, because that is the big thing. So the first steps we were thinking about yesterday was really establishing some harmonised data sets. So that is where everybody collects similar or, you know, if not quite the same data that talks to each other, and thinking about how we can then bring that together in some sort of, you know, a platform that we can have in a re-identifiable thing so we can actually collect longitudinal data. Okay, in the past, natural history studies meant you had to go along and see the doctors every, 6 months and we'd collect data. Now I think we can do it in a more naturalistic sense by uploading from your general clinical work into a sort of broader platform that can then, in conjunction with questionnaires that you guys might fill in, we can then start to collect very good longitudinal data. And for any rare disorder, that longitudinal natural history data is really important, especially as we move to clinical trials. Now, clinical trials, that's clearly where we're headed at the moment. But you need to know what the natural history of a disorder is and the sort of differences between people and trajectories that are really going to impact that. Now, there is lots of international work, but how that sits in the Australian context is something we really want to work on. And that's kind of where we're at the moment. So lots of work to do. We've started. We're getting people on board and we've started to get together in terms of a better, I won't say quite unified yet, but almost unified direction to go. So that's where we're at.